Okay, so our final topic of the day. Shannon Wickman, Devin Cain, myself are going to be presenting on bariatric support groups. Shannon is the bariatric dietitian and the bariatric program coordinator at Southern Maine Healthcare. Through her role, she coordinates the care of patients who undergo weight loss surgery and guides patients through the program. She brings 13 years of experience working with the bariatric population through nutrition and weight management counseling. Shannon earned her bachelor's degree in nutrition science from the University of Connecticut. She is a strong advocate for her patients and is passionate about helping people reach their health goals through nutrition education and support. Devin Cain is a licensed clinical professional counselor at Southern Maine Healthcare, providing assessments and counseling to bariatric patients. Devin completed her undergraduate studies in psychology at the University of Maine in Orono. She then continued her education at William James College in Newton, Massachusetts. Devin graduated with a master's in clinical mental health counseling, specializing in behavioral health and medicine. And I am a clinical dietitian and the bariatric dietitian for our program at Southern Maine Healthcare. You guys know what I do. That's my day-to-day, and I have been there since 2012, exactly 6 years this month. Very exciting. All right, support groups, here we go.
I'm 5. All right, as Sue said, but I think she was off the mic, we'll get you to the wine a little faster than we had planned. So the art of the bariatric support group, strategies for keeping patients engaged. This is hopefully just going to be helpful for you, give you some ideas that you can take back to your own programs. So why support group? Why is this something that we provide to our patients? Why is this important? How many of you belong to a program that's accredited by or are applying for accreditation by MBSA QIP? Is that most of you? Yeah, okay. So if you are, then you know that they require you to hold support groups at least quarterly. So, I mean, that's pretty minimal. But at least there is a recommendation that you have to have them at least 4 times a year. The research shows that all patients should be encouraged to participate in ongoing support groups after discharge from the hospital. And that's a recommendation from the 2013 updated clinical practice guidelines for the perioperative support of the bariatric surgery patient. Other studies, they're really limited. It's hard to really study the benefit of these support groups. So the studies are finding a higher level of support in general is associated with greater weight loss after bariatric surgery. Studies of either psychotherapy sessions or support groups after surgery focus on weight loss. So the outcome of all of these studies that I found is really weight loss that they're looking at, and showing modestly beneficial effect on weight loss up to 3 years after surgery. The primary finding was a dose effect. So this meant that these patients who attended 5 or more meetings in that first year after surgery were losing more weight. I don't know how important this is just to focus on support group attendance on weight loss as the outcome, but so we ask, is it only about weight loss? Obviously we know it's not. We want to be providing much more to our patients than just the promise that you'll lose modestly more weight if you attend some support groups after surgery. The other thing I found about these studies is that they're all looking at support group attendance after your surgery, after discharge from the hospital. So there wasn't much of anything on the importance of support groups before surgery. And in our program, we think that that's a really important time to engage people in support groups. So no, it's not all about weight loss. Here we have Devin leading a deep breathing exercise to help quiet anxiety. And that's something that Sue had touched upon, stress as being a big factor. A lot of our patients have stress just around eating after surgery, stress around their daily lives. So this was an exercise Devin did to help give some of those coping strategies for dealing with what's going on in life. This is some more research. So weight loss, typically the primary outcome of interest, but support groups are potentially beneficial in many other ways. Some of these possible benefits include improved health-related quality of life, fewer obesity-related comorbidities, reduced emotional suffering, reduced anxiety. That's a big one that we focus on. A heightened sense of community, especially at Southern Maine Healthcare. We're a small community hospital, and we find that our patients who attend support groups really kind of form a family there. So that heightened sense of community is important. Promotion of continued patient-provider follow-up. So Devin, Chelsea, and I are always at the support groups, and that's a great time to kind of see someone and say, hey, I haven't seen you in the office. I think you're due for your labs, or just touch up on things. Maybe they saw Dr. Carroll and say, like, what did he mean by that? So it's a good chance for us to kind of keep the patients engaged in the program overall. Access to a forum for improving knowledge, so a real forum for improving knowledge. We know that there's so many websites, there's so many blogs, there's so much misinformation out there, and it's so accessible to our patients that we hope that when they come to support group, that's a place that we can actually dispel some of the wrong things and give them real scientific backed advice. Enhance coping with changes in relationships, reduce risk of a return of old eating habits. And a recent Canadian study found that support group attendance was associated with being nearly twice as likely to engage in weekly physical activity in the years following surgery. So I thought that was a pretty interesting study on not just weight loss, but the increase in physical activity. So studies looked at patients who do not attend support groups, and those studies really showed patient bias. So patients who did not attend support groups were more likely to say something like, I would do the same with or without attending support groups. I'm not a support group person. This has never helped me in the past. I wouldn't like it. When asked to list the reasons for support group non-attendance, the top reasons included being too busy. That was the main one, and we understand that. These patients are getting their life back after surgery. They're re-entering the workforce. They're engaging in social activities that maybe they didn't. So we do hope that their lives are busier. So that's a reason that we acknowledge for not attending support group, but one that we hope that if they can just attend every now and then, that maybe 2 or 3 years out, when they start to see that weight gain, or when the social stimulants become more commonplace in their life, that they'll be like, oh yeah, I can go back to that support group. I'm established there. Feeling intimidated was the second most common reason for not attending, and that is something we really don't tolerate at our support group. I would never want a patient to leave our support group and say they didn't want to come back because they felt intimidated. So that's something that we work really, really hard to fight. The most frequently endorsed reason for attending support groups was to meet like-minded people, and I think that's pretty expected. So this is valuable information that these studies provided. It's valuable so we can use strategies to improve attendance by addressing the practical and the emotional obstacles, emphasizing the support group as an opportunity to interact with people who share similar interests, experiences, and concerns. So this is a little about our program at Southern Maine Healthcare. We are a low acuity program, so we're a small program. That means we do 25 to 50 surgeries a year. We have one surgeon. He's a general surgeon and a bariatric surgeon, so bariatrics is not the only thing that he does. So we're really small. We have 30 to 40 at any given time, 30 to 40 patients like coming up in the pre-op pipeline, which is usually an average of 6 months preoperatively from the time a patient starts in our program to their surgery date. And that's definitely an average, but that's what it works out to be. And we hold monthly support groups, so once a month. But our attendance each month is 35 to 55 people. So that's pretty good, right? We think that that's good. That's more than the surgeries that we're doing in a year. So these people are getting a benefit from this. But it wasn't always that way. So this was actually a quality improvement project that we did for our 2015 site visit. It wasn't the surgeon's most clinical favorite for a quality improvement project, but it was a problem that we were seeing at that time. The problem was our support group attendees were mostly pre-op patients. So they were attending out of this obligation to check off the box and fulfill that requirement. We require that all of our pre-op patients attend at least 2 support groups from the time they start the program to their surgery date. So that was the majority of the patients by far were pre-op patients. Post-op support group attendance was really poor. People would have their surgery and then kind of peace out. We wouldn't really see them back. We had 2 or 3 post-op patients at most support groups. So it was really pre-op patients asking each other the same questions, no one there to kind of answer those questions except us, and people were really looking for answers from other patients who had been through it. And patients often came alone, so they didn't come with a support person, and that's not a requirement. We don't require that they come to our support groups with a support person, but it's always encouraged. So these patients would come alone. They had many complaints of a lack of support for their new lifestyle at home, and they'd get support at the support group, but then they were going home to a place where someone wasn't understanding their needs or their wants or their new lifestyle. So it was really only helpful at that moment when they were at support group. So those were the problems we identified. What we did, myself, Chelsea, and Devin, we decided to alternate facilitating the group. So we planned topics, we added some more structure, and we planned activities within each of our specialty. So we would let patients know that tonight, Devin is really going to focus on anxiety and reducing stress, or Chelsea's going to focus on nutrition. She's going to do some protein samples, that kind of thing. We introduced the benefits of support group at our information session through highlighting all-stars who the patients would meet at group. So I don't know about your programs, but in ours, an information session is the first step. We don't have an online information session because we're so small. So we're all at our information session, including our surgeon. We hold those twice a month, and we started kind of putting like this is our great success story. This is Mark. He's a patient who blah 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 blah. But we always say now that Mark is really successful on paper. He's lost all of his weight. He no longer takes medication for diabetes. He's run 2 half marathons. But he's really valuable to us because he continues to come to support group. You'll see him there. He pays it forward. At almost 5 years out, he still comes and talks about his struggles and his successes and how he still has to use this tool of surgery. It's not just, it's not just something he had done and his life changed and he's happy. And Mark does come. He comes almost every month. It's a familiar face. Our patients, at their first support group, they're like, oh, that's Mark. Mark, I saw you on the slide at the info session. And so we're already kind of tying that in for them. We encourage attendance and through advertising on our Facebook page. So we have a Facebook page a week ahead of support group. I'll say, hey guys, hope to see you. It's just a reminder, blah, blah, blah. This is the topic we're thinking of. Is anyone struggling with something that they would like addressed instead? So the patients feel like they have more of an input into these support group topics. I'll call 1 or 2 older post-ops to remind them of support group date and time and any of our program changes. Chelsea recruits patients as she sees them in regular nutrition follow-up. And we really started to welcome support people, so the patient support person, and plan activities for them. And we actually, Chelsea will talk a little bit more about it. We actually plan a support group topic based on the support people and their input. So this showed a little of our outcomes. Our main goal for the quality improvement project was to increase the number of support people participating in support groups. So not necessarily to increase our numbers at support group, but to kind of change the percentage. So you can see the darker gray is the pre-op patient. The lighter gray is the post-op patient, and the kind of pink salmon-y color is the support people. So when we started, we really, it was all pre-op patients, very little post-op patients, and even fewer support people. And then, so by the end of this year and all of these changes, we almost had equal numbers of support people, pre-op patients, and post-op patients. And the environment was just so much better. People were getting much more out of these support groups because there were people who had been through it, people who were coming back years later and struggling, and then energetic pre-ops, people were getting their questions answered. So it was really a successful quality improvement project. This just shows it in a different view. So in 2014, 86% of the total people attending support group were pre or post-op patients, mostly pre. 14% of attendees were support people. And then in 2015, we more than doubled the amount of support people coming to the support groups. So that was good, and we could see that dynamic change. So what makes a good support group?
So what can make a good support group? So our dedicated team of licensed professionals, so as Shannon mentioned, myself, Devin, and Shannon are usually all three of us present at the support group, of course, not 100% of the time. And we also include people that our patients will meet along the way as they work through the program. So you all met Amy earlier today, who works at the Sports Performance Center. So we've had several of the trainers and physical therapists from the Sports Performance Center come to our support groups. The physician assistant, so we had a group that we'll get into a little bit more detail where a physician assistant came and kind of walked through the inpatient stay. We have a set location and time, so our support groups are always on the same time. They're always the third Wednesday of the month at 6 p.m. Because we're in New England and get lovely winter weather, we have a set winter snow day kind of policy as well. In the past, we had not. We follow the school, so we live in Biddeford or hospitals in Biddeford. The schools are closed, no support group that night. That can get really frustrating for a patient who maybe is coming to their first support group, is really hesitant about even attending the group to begin with, and they show up and the group's canceled. That it can become a real barrier. So having some of that kind of operational structure has become very beneficial as well. So our Facebook page is actually run by our patients. So there's several patients that work together to manage the Facebook page. And in support group, we had a whole group where the patients themselves talked amongst each other to determine who would be allowed in the group, the process for that. So in order to be accepted into the Facebook group, you have to be present at one of our support groups. And that means you're a patient in our program as well. And Shannon and Devin also have access to the Facebook page, so they can post reminders and monitor content and feedback a little bit as well. So feedback, checking in regularly. So at support groups, a couple times a year, we'll do a survey asking people, are you getting what you're expecting to get from support group? Are there topics that we haven't covered that you wish we would? What topics have been really helpful? How much structure do you like? How much structure do you want to get rid of? Open and honest discussion. So one of the things, besides just reminding patients of, yeah, there's support group coming up next week in our appointments, if we're talking about a struggle or we're talking about something that came up that was really unexpected for somebody, I really try to encourage the person to bring that to support group and share their experience. It can be with 35 to 55 people at our support group. It can be intimidating, obviously, to share something you're struggling with that group, but there's a lot of patients that do end up feeling comfortable sharing. In group, if not, asking for permission, would it be okay if I addressed this as something that might come up and something that we could kind of pitch to the group, and maybe there's somebody else out there that's struggling with it. Encouragement of the disclosure of good and bad patient experiences, so exactly what I just explained. Patient favorite support group topics. This one is awesome. So creating conversation between support people and the patient going through the process. So at this support group, we had the patients split apart from their support person, literally in 2 different groups on different sides of the room. We asked questions, similar questions to same groups, to the patients. What do you feel the role of your support person is? How do you communicate with your support person? And how do you feel supported by your support person? We asked the support people, what do you think your role is as a support person? How do you provide the person you're supporting with that support? How do you know when you're doing a good job being a support person? This was the responses, the conversation that this facilitated was amazing. There was a lot of, it was very interesting, I think, for people to hear how differently people utilize their support people and how differently people manage maybe a smaller support network. I have a support person that is really with me on this journey while I'm at work, and then I have, my friend at home, or I have my spouse at home, or this is how this family member's involved, and this is how another person is. It became very apparent the people who wanted the dictator type support person, if you see me doing this, just tell me to stop, versus the people who that's the least supportive thing. And we really wanted our patients and the support people there to walk away knowing that the conversation of what I need for support and how I offer support best is going to be an ongoing conversation. As you move through the different stages of surgery, preoperative, going through diet advancement right after surgery, and then the long-term maintenance phase, the support person role is there through the continuum. What the patient might need for support in each stage is going to change. And the longer we get away from surgery, the different types of support we need too. And it was such a cool group, really was. Setting goals, making realistic resolutions. We really try to tie this in at the beginning of the year, making sure that we're setting small, achievable goals. During this, we also talk about some different reward systems to use, so especially moving away from food-type reward systems and coming up with ideas, experiences, encouraging people to embrace experiences as well. Coping with change, embracing the experience of surgery. So we get a lot of people that get frustrated in the pre-op process. I don't know why I haven't gotten my surgery date yet. I just want to get to surgery. I can take care of these things later. So having a group that's really kind of getting in touch with why we have a pre-op process, why are we working on changing any components of lifestyle before, and what change looks like and what change feels like, and why change is so frustrating. I think it can sometimes, the patient is hearing from us as providers, you gotta change, you gotta change, you gotta change, we gotta work on these changes. These are changes you need to accomplish before you can get surgery. And why? And why is change so hard? So just coping with that, embracing it. That was a really awesome group. Staying active during the winter months. This was a really well-received group. We brought in the physical therapist from the Sports Performance Center and talked a little bit about activity that can be done in the winter, some of the other barriers that might come up with physical activity. And the physical therapist that came to that group actually printed out a calendar for each month from October to February and encouraged each patient, each support person, anybody that was there at that group to use that as a tracking tool over those months, and came up with different short-term, mid-range, and long-term goals that might be appropriate. There were so many questions from patients about stretches, walking shoes. If I'm gonna do this, what kind of footwear might I need? What if I notice this starts to happen? It was a really great conversation. So the nutrition review, when it's my turn to take over a support group, at least twice a year we'll do a nutrition topic. I always try to capture March for National Nutrition Month. protein shake taste testing. We get vitamin and mineral supplements from all these companies, and we'll have people try the samples, reinforcing our program's criteria, so reviewing the supplements that we recommend for the vitamins, B12, calcium, all that good stuff, what our fluid goal wants to be each day, why it might be beneficial to bring back a food journal for a couple days if we feel like we're falling off track a little bit, and just other strategies for keeping and staying on track with our nutrition goals. Any nutrition questions that come up, so if people have read anything, heard anything, support people love this session. Support people get so much out of trying some of this stuff, and also just hearing and having everybody reiterate the recommendations for our programs, knowing and kind of hearing again, reinforcing that the supplementation routine is not just the 3 months until you're on, a completely regular texture, regular food type diet. It's a lifelong thing. And then also just asking lots of questions about things that they may have heard also. And information sharing between the pre-op and post-op patients during these sessions, amazing. What protein shakes worked before surgery, after surgery, how things changed. I think as a providers, we can talk about that all the time, but to hear how, I love this chocolate Ungery before surgery, I was drinking it 4 times a day, no problem. After surgery, I can't even look at a canister of Ungery, it just don't even show it to me. So it's different for patients to hear that from each other for sure. So this was when we did our inpatient stay, we also included some of the nutrition components there and had some trays, and we also had people practice sipping 30 mLs of water out of a medicine cup. That's what our surgeon does initially right after surgery in the hospital. So we had them sip that over 15 minutes to really put into action what it might be like. And again, there were several post-op patients that shared their experience of how difficult it really was based on their expectation preoperatively. Healthy holiday eating. This is definitely the #1 fan favorite group in our program. So we do this every November. And really the main goal of this topic is to decrease as much as possible the stress that goes into eating around the holidays. It's stressful for anybody, not just people that have had bariatric surgery. There's so much stress in general at this time of the year. So we talk about strategies for navigating social gatherings. So for a lot of people, a lot of patients, this might be the first time they're seeing their family, their extended family, since they've had surgery. And they've lost a lot of weight. There will be a lot of questions. So again, between the pre-op and post-op patients, the sharing of information, how did you handle your first family event with people asking you these questions? How much did you share? What did you feel comfortable sharing? What were people's reactions? Again, if we lessen some of those anxieties, some of those worries, overall stress for our patients will be less. We're gonna promote a better spot for success there. We'll talk about non-food-based gift ideas or transitioning maybe a food-related celebration with a small group of friends or coworkers to more of an experience type of thing. People share, again, a lot of ideas here. Another thing that we do in this time of the year, at usually the December group, we will have people write a card to themselves that we open up the next year in December. There's so many people that are years and years out, 3 years, 5 years, 10 years, that come back to one support group a year, and it's in December, so they can open their card from the previous year, and it is really cool. So we just give blank cards. People write, a letter to themselves, what they hope to be doing a year from now, seeing a year from now. We ask people that are comfortable sharing to share their experience and reading their card now a year later. And, most people in the room probably had surgery within that year, but not everybody. And that is a really cool thing too. And we keep the cards. Shannon keeps them all year long.
Every year it's a panic. I have them somewhere.
She always finds them every year. So the inpatient experience, this was a brand new topic for us. So we've done this one time and we did it fairly recently, and it was amazing. So we had Casey, who's our physician assistant, who patients wouldn't otherwise meet until their post-op upstairs in the hospital. So it was really cool to bring a name to face preoperatively for any of the pre-op patients there. So Casey did a lot of talking about what to expect when she comes to visit you in the hospital after surgery, what questions she's going to talk to you about, what you're going to hear from your nurse, what the discharge criteria are going to look like, the importance of hydration. So if you're not going to be drinking water, you're going to be staying in the hospital longer, why it's important to use the incentive spirometer, as one of our patients graciously demonstrated for us. It was a really awesome group, tons of questions, and again, a lot of post-op patients being able to share their experience of what it was like in the hospital, anything that came up that maybe they didn't expect, what went really well. Gives us a ton of insight too into what people experience and how different everybody's experience can be too. You can have two surgeries on the same day and the two people have completely different experiences. So recognizing that is helpful too. All right, and then deep breathing. So this was a group that Devin just did recently as well. So pictures showing everybody practicing the deep breathing exercises. Only feedback on this group is people got really relaxed. So we ended with a little open discussion and people were pretty tired and pretty relaxed. So maybe open it up first and do the deep breathing second. Yeah. I'll let you guys read that as we transition.
This is one of the things I really love about having a Facebook group page. Like Chelsea said, we moderate it, but it is patient run. It's a great place for patients to put feedback like this on there, and as well as share apps, share recipes, other things like that. So I'm going to talk a little bit about the 6-month post-operative group that I run for the bariatric patients at SMHC. This group started a little over a year ago in May 2017. We meet once a month for an hour. Usually goes a bit longer than that, but that's okay. We meet conveniently in the bariatric office. I say conveniently because I don't have to schedule a room, and I think it's convenient for patients as well because at this point they've been to that office many times. We meet in the office after clinic hours as well, so I think that this space provides privacy for patients. The 6-month postoperative group has a 6-month requirement. To attend this group, a patient must be at least 6 months out from their surgery, and there's 2 main reasons for this. We want to continue to encourage attendance at the pre- and postoperative group Chelsea and Shannon were just talking about. It's really great for new postoperative patients to be able to continue going to that group, sharing their hospital experience, as well as sharing any dietary changes during the first 6 months after surgery with the preoperative patients. Preoperative patients do get a lot of good information from the team before surgery, but it's so beneficial from them to hear it straight from the post-op patients and get that firsthand experience as well. There was a bit of a debate whether to open this group up a little bit earlier, as patients in the regular group were asking for it. We had questioned whether we should open it up maybe at 3 months or right after surgery. The reason we went against this was because we were concerned that patients would go right from surgery to this pre-op group and maybe not go back to our regular pre and post-operative group. And then our pre-op patients would really be missing out on those valuable experiences from the post-ops. The second reason we set this 6-month time frame is because this is right around the time that the honeymoon phase might be ending. At this time, patients might start to see an early plateau, or they might at least start to see their weight loss slowing. At this time, patients also might be a little more comfortable with their diet. They might be tolerating regular food successfully. They could have settled into a routine and really figured out how to meet their needs. So during these group meetings, we talk less about weight loss and diet and a little bit more about lifestyle change and how to maintain these changes long term. Participants of this group, participants are patients only. In the early development of this group, I did put it out there to patients, do you want it to just be a patient group, or do you want your support people to come like our regular group? And they opted for a patient-only space. Patients seem to enjoy having this space and the time for themselves. It's worked out really well because a lot of times some of the things that we talk about are actually the support people themselves and how support may have changed immediately post-op, 6 months out to a couple of years post-operatively. As you can see, we have a significantly smaller group than the pre and post-operative group. We usually have anywhere from 4 to 6 patients attending and myself. Although we do have a small group, we have a pretty good mix of patients anywhere as far as surgery dates. So anywhere from that newly 6-month mark to about 4.5 to 5 years out at this time. And I think this is great for post-ops coming in that are at the 6-month mark. They can hear from the patients who have been doing this for years. And then I think it is also great for the patients who are, 4 and 5 years out because they can find new motivation here from seeing recent post-op patients. Our curriculum, we really don't have a curriculum. I would say that we have kind of a pattern or that we are in, but this is a support group. It's not a closed psychotherapy group, and I think this is beneficial because patients, as they need support, can come and go. A closed psychotherapy group would have a group cycle, and patients might say, wow, I really need support this month, but hey, I need to wait for the new group cycle to start. I think this can be a barrier to follow up, and we're just trying to get as many people to come to this group as possible, so we don't really love to set limits on things like that. Although there is no curriculum, like I said, we do have a pattern. Typically at the beginning of group, I'm asking patients if they have any pertinent topics or questions that they would like to talk about. Usually this can take up most of our group, and it's why we go a little bit over an hour. And I think this is because we're seeing each other monthly, so a lot can happen between the month that we aren't seeing each other. I like leaving the group open in this way because I think it allows more for patient discussion and patient interaction. Allows me to definitely take a back seat to things. I do a lot less talking, and the only time I'm really talking is to guide patients or to further ask questions so patients will share more. I also like to have some kind of backup plan, so there might be nights where patients aren't feeling too chatty, so I myself before group might do some research, print off some pamphlets, or have something prepared just in case there is some dull down time. That way we're utilizing that full hour that we're there. I think it's important to note that I see all of these patients individually, preoperatively, and then I'm seeing them the 6 months up to this group while they're still in the regular pre- and post-operative group. So while I'm in session with them, if a patient were to bring up a topic that I think could use group attention, I might ask something like, do you mind if I anonymously bring this up in group? Most of the time the answer is yes, and I think that patients really appreciate this attention to some of the problems that they're having. Because of this, questions can be asked and answered with honest support and without anyone having to feel like they're embarrassed or being put on the spot. So what are some of the topics that we've talked about over the last year? How to, maybe not like specific questions about diet and exercise, but how to maintain diet and exercise, as well as fitting these into a new lifestyle for the long term. We talk about weight loss plateaus, decreasing support, body image issues, developing and maintaining healthy coping skills. And I think along with that, definitely making sure to avoid old habits when feeling stressed or emotional. We really want to help patients use their new coping skills instead of going back to the old ones that they had before surgery that might have gotten them to surgery in the first place. We talk about changing relationships, both with people and with food. This was something that I first heard during a post-op group from a patient who was 4 years out. He was talking about his preoperative friends and his post-operative friends, and how when he's actually sitting there with his preoperative friends going out to a Chinese food restaurant, he notices some of the old habits coming back. So it's definitely an important issue to talk about. We discuss long-term goals and new goal setting, which really does help keep patients going and help keep them motivated. We talk about successes, which is one of the most lively parts of our group conversations. We talk about barriers to success and way to prepare for these barriers. And finally, we also talk about self-worth. And I think this is probably one of the most important topics that we talk about in our post-op group. I kind of see self-worth as this underlying interwoven theme that's the root cause of so many issues, preoperatively and as well as postoperatively. Post-op patients, even after reaching their ideal weight, or their medication list is cut down to just their vitamins, or they're excited about keeping up with their children, may still have issues with self-worth. And it's reflected in their actions. Some people do say it right out loud. We've had people specifically talk about self-worth in group. But either way, I see patients that are still taking care of other people more than themselves, putting others' needs above their own, and they might even start to slip back into the old habits they had preoperatively. They might even see some weight gain. This is definitely a large concern for our postoperative patients, and I think it's a reason that they keep coming back to group. Self-worth and engaging in self-care is a topic that will be important to discuss with postoperative patients to make sure that they're successful for the long term. They need some kind of internal motivation to help maintain successes, set new goals, and fight through any barriers. A helpful quote that I find myself saying to patients a lot is that you can't fill someone else's glass if yours is empty. Oh, barriers. So I would say the one major barrier that we had has been group attendance. When I first started the group a year ago, we had quite poor attendance at some times. There were times where we were canceling on Facebook, or even sometimes where 1 or 2 patients would show up, and we might sit and talk for 15 or 20 minutes just to make sure that patients were heard, but would end up going home early. And I think this difficulty came from trying to fit everybody's schedule. After surgery, we definitely noticed an increase in functioning for our patients. After weight loss, they might be going back to a part-time job, a full-time job. They might be expected to do more around the house, so their schedules are just busier and busier than what they might have been preoperatively. To increase group attendance, I changed my follow-up schedule with people individually. So after surgery, I started seeing people individually at 2 weeks, 4 weeks, and then once a month for that first 6 months. Patients would see me individually, and then at that 6-month mark, they would graduate into group. I would still offer individual sessions if people really wanted them, but most people would find that seeing me once a month was enough. And after doing this, we definitely noticed an increase in attendance. We also started promoting the post-op group during our regular pre- and post-operative group. We were very lucky to have some post-op patients also speak up in this group and mention us. And it's really helpful when it's coming right from post-op patients and they can kind of rave about the group. Like I said, the experiences they have speak greater than to what we might be able to say. And I think that brings me to my last point, which, why is having a post-op group important to patients? Like I said, I see many patients individually during that first 6 months after surgery while they're still attending the regular support group. I have plenty of patients that will express a concern. I say, hey, you should mention this in groups so preoperatives can hear it. And they might say, oh no, like I don't want to scare them away. They really do fear for some preoperative patients. And while I definitely appreciate that they care about our group success, I always try to explain the importance of them sharing their knowledge and making sure that they're getting the support that they need as well. And then it's very likely that pre-op patients, although they might scare them to hear some of that information, it really is important, so they're not really surprised at something similar happens to them post-operatively. And I have this great quote here from one of our post-op patients, which I think really speaks to the importance of giving them their own space. Our patient said, "This is a place where we can come and be ourselves for an hour. It's like I get to take off a mask and be the real me without having to worry." Oh, this is one of our great success stories. He was finally able to go skydiving. I'll read this quote from him. He said, "I had to work so hard to be under 240 pounds to be able to achieve this. Worth everything. I'm living the life I always wanted to. For me, it's more than a weight loss program, it's a lifestyle redo program. Thank you for all the help, encouragement, example, and tools that keep me going. We are all winners." I'm gonna let you guys read these ones, but again, it's more quotes from what our patients are saying. I think these were all posted on our Facebook. Yeah, posted on our Facebook group. Okay. Just give them a couple of minutes. I don't think we have a question slide. I think we just have our reference slide. Okay. Should I go into questions? Yeah. Okay. We're going to leave this up. The last slide is just our reference slide. Does anybody have any questions about groups or anything we've talked about today? Yeah. Run.
How did you go about getting funding from your program to be able to provide things like to be able to bring people in or provide samples of things or whatever?
So I guess we don't. I think we work with some really awesome people who, like the physical therapists, I don't know if they worked that into their day. Most of the time we're all SMHC employees, so I don't know if they work it out with their manager to have it be part of their day or if they're donating their hour to come to group. Usually our guest people, we don't expect them to be there the whole hour either. And then the samples are mostly provided by companies. So we aren't allowed to hand out samples in the office. So if a company Celebrate calls, Unjury calls, Bariatric Fusion calls, and they want to send us samples, we will accept them, hold on to them, and then disperse them at a group type setting. So, and I'll usually try when I do the protein shakes, I'll usually try that morning or sometime that week to find a protein shake somewhere very local to the hospital. So like the Rite Aid I pass on the way, find one that meets our specifications and also offer that as a comparison and for people to recognize that these things can be found without ordering them online too. Just to bring reality into it. Yeah.
Some programs, do any of your programs still charge program fees for people who are entering? No. So None anymore? Okay. Yeah, some programs would charge a program fee and that's what it would go to. And they could do kind of bigger and better things, but I guess no one does anymore. We don't, but I was wondering.
They are, yes, so the standard monthly support group is 6 to 7 p.m. and Devin's is 6 to 7 p.m. as well. Yeah.
Have you ever tried it many times? There's a lot of like staffing concerns. I don't like to work late.
Yeah. The late night once a month is
You offer basically two groups, and you said, do all three of you go? Okay.
we do most of the time. I would say at least 8 out of the 12 groups annually you're gonna find all 3 of us. We did, so timing wise, our hospital has 2 locations, one in Biddeford, one in Sanford, and we started offering our information session, our monthly information session at the Sanford campus from 1 to 2 p.m. instead of from 5 to 6 p.m. Amazing, the difference in attendance. We went from having 1 or 2 people at that information session to 5 to 8, maybe, yeah. And people are willing to travel between to make at least that, so that's increased access to our program. Will we do something with support groups similar to that? Maybe, possibly. I think there's a lot of barriers, 2nd shift, 3rd shift type of thing to making it to support group, and we wouldn't want that to be the one thing that would hold somebody back from having surgery either. So maybe, yeah. Yeah, yeah. I mean, yeah, it is, 6 to 7 is tough, but I mean, yeah. You guys have a lot of dietitians, everybody can rotate through, right? Exactly.
But I think for the same reason that you don't like to be there late is the same reason why the patients can't come earlier, that 6, even the difference between 5 o'clock when we say that our information session is at 5, people are like, all right, then I'll have to see if I can get out of work early. So, but the 6, almost very few people have to leave work early or change things, so it does make a difference.
I think something else that's important about that too, like, so for our support groups for the pre and post-operative group, we have that minimum of 2. Even if somebody is working or has kids or they just can't get to it easily, if they can get to at least 2, that shows us a huge commitment that they are willing to move around something in their schedule to go to these 2 groups. And we hope they get out a lot of the 2 that they go to, but it definitely shows a big commitment for them to be able to move around their schedule just to get to those.
Anything else?
I was wondering if I could get a show of hands for how many programs have a separate nutrition support group. We have a pretty big program, and we have a big support group with about 100 people with general topics, but they ask us to do a separate nutrition support group. So I'm wondering how many programs offer that.
About 4.
So is that in place of one-on-one dietitian visits for some patients, or is it just
No,
some?
just a general support group for our post-op patients. We don't really get a good turnout, and a lot of times these people really just need one-on-one support. So that's what I'm finding.
Yeah.
So I'm just wondering if this is something that others do, or I don't know. Just it seems like we could be using our resources better.
Now I'm going to close it up. Bring it back to the cocktail hour. Did that come right up?
What we've all been waiting for.
Yeah. All right, we're gonna wrap it up. This was so wonderful. Thank you guys for attending. Thank you, UNE, for being our host today. This is such a wonderful location. We couldn't have even thought of doing this without you guys agreeing to co-host with us. Thank you to our speakers. Thank you to our sponsors, who I think most have gone, but they have left a lot of samples out there, so please take some and take information if you're walking out. What else did I want to say? Anyone here from Vermont?
God, yeah, we should do a show of hands.
Yeah. So this is a small conference, as you all know, but it's so important because bariatric dietitians are so specialized, and this is really the only place where we really get like all bariatric stuff. So I'm just thinking of who could host next year. Vermont is the only state in New England that hasn't yet hosted. So if you know of any Vermont bariatric dietitians, kind of put that bug in their ear. But it's a lot of work to plan, but it's a lot of fun too and really rewarding. So just be thinking if anyone wants to host next year. The CEUs, did you want to talk about the CEUs?
So if you can turn in your evaluation at the table, there's just a stack that's starting, and then the CEU certificates are right next to it. You'll fill out your own name. They're just pre-made with the date and all that good stuff. And if you're not an RD, there's a certificate of attendance there available for you as well.
Sue, don't forget your basil.
Yes, and Sue.
She's in the back there.
Oh, don't forget your basil plant on the
I think
table.
there's one on the back table.
Yes. Awesome.
And you want to say about the tickets?
Oh yes, if you're staying for the happy hour, networking hour, the 2 drink tickets should be paper clipped in your folder. And if you didn't pick that ticket but you want to stay, we have drink tickets for you and would love to have you join us. So just see us. Thank you guys so much. This has been an awesome day. Appreciate it.